The Smart ABI is a clinical diagnostic tool designed to test all your patients at risk for peripheral arterial disease. Studies show PAD to be increasing as the USA population ages. 67% are asymptomatic and underdiagnosed across the United States. Test patients over the age of 65 years, not previously diagnosed with PAD or having an ABI within the past year. Test patients over the age of 50 years with a history of smoking or diabetes. Test all symptomatic patients. Examples include but are not limited to claudication, critical limb ischemia, non-healing ulcer, wound or neuropathic leg pain. Utilize the AHA PAD survey to aid in the identification of patients that would benefit from PAD testing. The Smart ABI performs a 1-minute test, not operator dependent, that accurately measures a patient's ankle brachial index, blood pressure, and body mass index. Simply install the Smart ABIs on the arm and 2 ankles. Ensure the arrows on the cuffs are placed in the appropriate position and pointed in the right direction. It takes only a minute. The system is designed with redundancies to preclude testing errors and makes it easy for repeatable, reproducible, and standardized testing by healthcare professionals of all skill levels across health professional staff. With easy-to-use touchscreen design and only 2 screens for data input, it is very simple to conduct a test on a patient. Simply select an existing patient or set up a new patient. Input name, birth date, sex, height and weight, reasons for visit, and optional information on a current treatment or disease. For testing, there are only 2 pages, directions and monitoring. Then to start the test, click the white button on each ABI cuff and click Continue on the tablet. ABI cuffs begin connecting via Bluetooth and inflating simultaneously. In less than a minute, the test is complete with a finished quantifiable diagnostic report. Upon test completion, the Smart ABI generates a report that is immediately ready to be reviewed by the doctor. The report is also patient-friendly for education and prevention purposes. The report includes quantitative and patient-friendly color-coded graphic scores that indicate normal, borderline, or severe. Utilizing the report, establish a quantitative baseline. If acceptable or borderline, then educate the patient. If the report concludes non-compressible or severe, then refer to a vascular surgeon. If the report is normal, see and test the patient again in a year. The second page reports trend data for the last 4 visits to help the healthcare professional manage the patient's disease progression and educate the patient. The Smart ABI allows you to manage your patient's PAD rather than wait until it's too late. The direct result is to reduce future surgeries, amputations, and hospitalizations. Test all your patients at risk. Educate your patients of their risk of future surgery and prevent surgery and amputations. For Smart ABI product consultation, please call 877-275-8760 or fill out a contact form on our website at www.smartabi.com. Your fast, 1-minute, simple and effective test.